Thank you, everyone, for taking the time to listen to me. And sorry about my little tardiness coming in, but hey, better late than never. I think this is really timely information that I'm going to talk about, which, when we generally get together and talk, we talk about the benefits available to you conceptually. But today we're going to zero in on the mental health benefits available to you through the medical carriers that you have a choice of. It's very timely because we are now in Mental Health Awareness Month, and it's a topic that I think we speak too infrequently about. So I think it's good that we do talk about this. Prior to the Affordable Care Act, which has defined or redefined what healthcare today is, there were some true limitations as far as what was provided under the medical plans for mental health care. Typically, you had a maximum of maybe 15 or 20 visits per calendar year. That has changed. Since the Affordable Care Act, mental health, behavioral, and substance abuse issues are treated the same as any other medical condition. So if you need to see your therapist, 30 times in a year, that is supposed to be provided to you, unlike in years past. So keep that in mind. What we're talking about right now is traditional group or one-on-one talk therapy, where you are going in or maybe on a Zoom call with a provider to speak about and learn about ways to deal with your situation. I have learned a lot over the past week or so since I was asked to speak to you about this. I have learned that mental health care looks very different than what it used to, and that it has evolved quite a bit. Mental health care, the topic medically has grown so quickly, and one of the issues is we don't have enough providers. So we need a lot more mental health care providers, and it's hard to make an appointment. We have moved to a model where more mental health care is provided via online apps, more Zoom meetings than what used to be out there. And so the whole face of mental health care is changing. All of the carriers, Kaiser, Blue Cross, and Cigna plus Oscar, which are the three carriers, they have unique tools custom tailored to the members of the organization that you happen to be a member of. I'm going to talk about some of these tools, and I'm also going to be making available to you flyers from the carriers regarding these programs. These will be up on the Ease enrollment platform probably next week. And also, as I understand, you might have a company intranet where you might have available information where people can go. I'll get this out in any fashion that's available, so you'll have these tools available to you. Most of you that are enrolled on the medical plans, most people are enrolled in Kaiser, and Kaiser has made available at no charge to their members 3 online apps that most people, if you're not a Kaiser member, you would go to the Apple App Store and pay whatever sum of money for it, but it is available to you as a Kaiser member at no charge. The 3 apps are Calm, My Strength, and there's a new one called Ginger. And there's some similarities and some differences between them. I'll just name off a few of the differences and just to kind of give you an idea. I looked at Calm, And Calm is the #1 app for sleep and meditation. They apparently have 100+ guided meditations available on the app that you would be able to utilize. They have sleep stories for deeper, more restful sleep. And they also have music tracks, which you can use for focus, relaxation, and sleep enhancement. So those are some things about the Calm app that you'll be able to take advantage of. The second one is Ginger. Ginger is unique because you can actually conduct one-on-one meetings with an emotional support coach. You can discuss goals and create an action plan, and they have other self-care resources available to you that are custom tailored based on what you wish to address. So I really like that feature about Ginger. And the third one, My Strength, will help you to develop a personal support plan. They also have tools to manage stress and other activities and articles and videos that you would be able to look at to help you out. So those are the three main programs through Kaiser. And one of the things I do want to mention, all of these programs, they are not designed to replace a traditional clinical setting type visit, but they're designed to augment and also give you the opportunity for self-care. So something to keep in mind. This is not an alternative necessarily to a traditional clinical setting type appointment. Anthem Blue Cross, for those that are on Anthem Blue Cross, you actually have available to you a full-fledged employee assistance program, which provides phone consultations up to 3 visits per issue. So if you're calling in and you have a particular issue, you'll have 3 visits. 6 months later, you have a totally different issue. You'll have another 3 phone calls that you'll be able to make. Some of these can be in person, so they might set you up with a provider in your area that you'll be able to see. There's legal consultation, financial consultations, ID recovery. So the employee assistance program available to you through Anthem Blue Cross, it's a little bit different than the ones available through Kaiser, but it's definitely a good service and available to you. Again, I will have information that you'll be able to obtain from Ease, other resources, all of this information that I'm talking about on Blue Cross, Kaiser, even the Cigna Plus Oscar. This is all information that you can find on their website as well. So utilize kp.org, utilize High Oscar for Cigna Plus Oscar, and so forth. Real valuable information. Cigna Plus Oscar, they have a program called Talkspace, which I believe is also an app that's available, but it's available to you free as a Cigna Plus Oscar member. You'll be able to set up online therapy programs. You'll be able to speak with a provider. You'll be able to message your provider. It's supposed to be a very, very robust program. So all the carriers, they're doing what they can to put the tools out there that people need to help address a lot of the stress issues that we're dealing with each and every day. I think a lot of these programs, these online app type programs, it's helping to take the pressure off of a lot of the more clinical settings where they can help people with more pressing issues that need a true one-on-one coaching type scenario. So good information there. I do want to impart something else that's really important. If you are experiencing or you are witnessing someone with a medical or psychiatric emergency, do not call your provider, do not make an appointment, call 911 or go to your local emergency room, because they are best geared to help with emergency crises as they appear all of a sudden. So something to keep in mind there. That's really about it. I do have time if you all have any questions about how mental health care is provided by the carriers. More than happy to help you. I'm also always available to you offline. Most of you have my contact information. Feel free to reach out to me at any time if you want to start talking more to me conceptually about these programs that I'm talking about. So my services are always available to you, not when we're talking in these forums, but whenever you need me. So any questions?
Hey, Craig.
Hello.
Hi. So back in February, you gave me a flyer that Kaiser offered. I think it's on their website. I couldn't find it on their website, but it talks about the apps that they had available back then. Do you know, do you have something that, I know it's supposed to be on each of their websites, but do you have resources where there's a flyer similar to what you had sent me back then for each of the different insurances that we can just shoot over to everybody so that they have it in case they need it?
Yep.
Okay, cool.
Yep. I will get all of that to you.
Awesome. Thank you so much.
You betcha. Anything else?
I can definitely verify that Craig is very responsive. Many of you have his email address. Most of you should. At some point or another, he's reached out to you. Cindy and Charlotte, you can expect, if you haven't already, to hear from Craig. Whenever there are issues with respect to your benefits, whether it be mental health, whether it be just general health, that you don't want to talk to me about, you can always talk to Craig about it, and he'll keep those things in confidence. And so we've been working with Craig for, I don't know, 20 years, probably, maybe even longer. I don't know.
25, Paul. 25.
25. Yeah. So there's never been a ethical lapse disclosure. I've never heard anything where I'm like, Craig, you shouldn't be telling me this. So he's a trusted resource.
Everything is always kept in strict confidence. I can assure you of that.
I back what Paul just said, and Craig answers his cell phone while he's on vacation also, just so everybody knows. I
don't have a life.
Calls while he's been on vacation. And he does. He's gone above and beyond. He's helped me with things that Collins didn't even cover. Just pointing me in directions to help me. So he is a really huge resource for you guys. So definitely everything Paul just said and then some.
Thank you. I enjoy working with you all and dealing with you all in a one-on-one and helping you with your needs. That's the number one thing that I enjoy about my job.
Okay. Well, thank you, Craig. Appreciate it.
Take care,
thank you for being flexible with the technical difficulties.
Hey, no worries. Those things happen. Take care, everyone.
Okay.
Bye-bye.
Right. If everybody else can hang around for a sec. The Collins Management Foundation does have, if you're in a situation where you need help and you really don't know where to go, and you don't have you don't have the finances to hire an outside therapist, come to me. Maybe I can help. I've done it before. So if it's a good thing that Kaiser and Anthem and Cigna are offering more and more services to mental health. It's not enough. We know what happened in the last year with Andy. We probably all have a lot of personal anecdotes. And right now, the American medical system is not really set up to offer much more than what Craig described. So if you find that you're in a situation where you need a little bit more help, you can always come to me, and You know, you don't have to tell me everything. Just say, hey, I need a little help with this. And you know, the resources are not endless, but I'll try to help where I can, because you know, I happen to be in a position where I can offer that assistance. So if you're struggling and you need help, please come to me. Okay, and rely on each other. Always be there for each other. Make sure, and this is advice I'm giving myself just as much as to anybody else, is make sure you're getting enough sleep. Make sure you're getting enough water, enough sunlight. Make sure you're, you know, some sort of physical activity. You know, it doesn't have to be much. Just go walk the dog. You know, and these things are things that I try to do, and when I do them, I can function. I could do the job that I have at Collins Management. I could do the job that I have as a father. So I know you all know this stuff. I'm not trying to tell you what you don't already know, but I just think it's worth restating the obvious. Bree, are we wrapping up, or do you have anything else that you wanted to add or address?
I just want everybody to know that I appreciate everybody logging in and joining us for this. It's something that's very dear to me and close to me and my family, and I'm glad that everybody took the time to listen to Lance. I know attorneys can be kind of boring sometimes, and to Craig. So, and if you guys have any questions or you want, you know, some links, just shoot me a message and I'll get back to you as soon as I can and give you what I have.
Yeah, Reed, thank you so much for putting this together. I really appreciate you and what you've done. And to the extent that the social committee assisted you, thank you as well. It's kind of funny that the social committee was working on this. I don't know what's funny. It's just kind of funny. But I also wanted to reiterate what you said. You know, the steps that Lance laid out, you know, there's a certain personality type that goes into this line of work that tends to be successful in this line of work. And that personality type has a little bit of anxiety, because without that little bit of anxiety, you're not getting as much done. But there's still boundaries, and there's still a process. And if you utilize these boundaries in this process, you don't have to feel like you have to scramble and respond to every little thing immediately. You just have to make sure that you get things into the process, because you could run yourself ragged getting emotionally connected to whatever emotional state the other person's in. And if they're in this, you know, hyperactive, high anxious state, as a homeowner or a board member, it's very easy to adopt and adapt and become and mirror that. So as professionals, these are the tools to follow a process that will get to the desired outcome, but still creates a process that is least likely to result in you feeling overwhelmed, not knowing what the next step is, or feeling like you have to act urgent, like your hair is on fire. So I'm going to break up these videos into two separate videos. One with Lance, which will become part of our, you know, educational videos, and then I'll do the benefits one as a separate one, so that it can be provided to you know, future hires and things like that. So with that, does anybody have anything to add to the good of the order before we say our goodbyes?
I do.
Hey, Sue.
Hey, just to back up everyone.